Because you do a lot of Invisalign and a lot of braces, how do you usually manage those kind of cases? Because these patients will often come in and say, hey, I have a mild pain, but I want to straighten my teeth. What do you usually do?
The first step that we got to do is to, during the initial checkup, we have to look at this and not just at the teeth, because a lot of people will come in and say, oh, I want to make my smile nicer, which is very valid and I'm happy. But often they don't realize that some things that is causing, they might be saying, oh, I think I have an asymmetrical smile. It's not so even. And then it could be actually a symptom of what's going on. Like the joint could be actually shifted, like we were talking about. It's biting in a different way. And then that's causing the smile to look not so symmetrical and nice. So to me, the most important is during the examination, we have to check this area, see whether there's any clicking, any symptoms like that. It could be clicking, it could be like a dislocation where you can feel it sort of pop out, right? And it can be a bit
That's
scary.
quite common actually.
Yeah,
More
it can
common
be a
than you
bit
think.
scary.
Yeah.
It feels
Yeah,
like
it's just
it
like
sort of
yeah.
goes, and then it could be on one side, it can be on two sides, and also some patients will say, oh, I always had that and I thought it's normal. Yeah, which it can be. I mean, but then some patients will say, oh, I have never been able to open very big, very wide. Yeah. So that's really important for us to gather that information and to see like if there's anything that's physically blocking it. Sometimes it could be like the teeth. Instead of being sort of straight like this and biting like this, the front teeth, the top teeth could be inwards, and then when they bite, instead of being able to bite out, it's being pushed back. Yeah,
so your jaw is getting pushed back.
Yes, as they bite.
Yeah.
So that could be we call it a constricted or closed bite, right? That it gets
squeezes against the muscles over here and the joints over there.
Yes. So when we are aligning the teeth, we want to make sure that we are giving space for the joint to move where it can be. And also we are moving the teeth into a position where it is good for the overall sort of position of the joint and the muscles, rather than to move them in a position where it's, like in your terms, not so happy, and then it could cause other problems. In fact, sometimes when you move the teeth, it could create some sort of more pain or more jaw problems. So we have to be very, very careful not to have that happen.